Hello, Dr. Deepak.
Yeah.
Yeah, you are live, sir. You can start your presentation now.
Okay.
Yeah,
So
thank you.
hello, good evening. So thank you for Librate for giving me this opportunity to have few words regarding the lifestyle and dietary changes for the kidney stone patients. Now, why this topic? There are two reasons. There have been studies in US where over last 3 decades, the prevalence of the stones have almost doubled, and the persons who get stones, so in the coming 5 years they have 50% chance that they will get another episode of the stone. So that's why it's important, like what lifestyle and dietary changes the patients can do so that their chances of recurrence of the stone is less. uh, the stones, they are formed in the kidney, and from the kidney the stones may drop into the ureter, as we can see here. And that is one of the most common presentation, how the patient presents. The stone formed in the kidney drops into the ureter, it got stuck there, there is swelling in the kidney, and they present with the pain, vomiting, flank pain. When it comes down, it passes through the bladder. In case if it doesn't pass, it will need the endoscopic removal. And the cause of the pain in the stone is because of the swelling which happens in the kidney. The patient goes to the urologist and their doctor, and he advised the ultrasound, CT scan, few blood and urine tests to find the exact size of the stone and the exact number of the stone and where exactly it is located, and accordingly the treatment is planned. It may be a medical management, or it may be an operative one. In case the stone doesn't come out with the medical expulsive therapy, then the endoscopic removal of the stone is being done. So somebody whose stone is stuck in the ureter, is it is always advisable from them to consult your local urologist, follow his advice. In case you develop fever with the stone, please report immediately. You may need an endoscopic removal of the stone. And don't wait unnecessarily for long periods. I have seen people waiting for very, very long periods. And if you wait unnecessarily for long periods, the stone causes pressure on the kidney, and it can have an adverse effect on the kidney. And we have seen patients losing kidney just because of the stone. So we feel very bad for them. Now, it's very important to understand, why the stone formation occurs. So initially there is a calcium, it may be a calcium carbonate, calcium oxalate, uh, particle deposition in the kidney. And there are three basic factors for their deposition, for the crystal formation. So one is the low urine volume, that is the dehydration. So that is very important, because when the urine volume is less, so relatively the concentration of salt is more. And when the concentration of salt is more, so that becomes super saturated, and those particles, they are deposited in the kidney. That's why the stones prevalence is very high in the hot and dry climates, because there are a lot of evaporation of the fluid from the body. Second, the people who are excreting more calcium, oxalate, phosphate, and uric acid, these crystals in the urine, so their excretion is more, so their supersaturation will be more, and they will be deposited. And third factor is citrate. So citrate is actually a friend for us. So it inhibits the calcium oxalate and calcium phosphate stone formation. So when the citrate level is low, the stone formation will be more. So these are the three basic factors. Now, how to prevent the stones? Like, as I told you, the dehydration, the low urine volume is one of the important causes. So the most important thing to prevent the stone is to drink plenty of fluids. We should drink at least 3 to 3.5 liters of the fluids daily. Now, this is very important. Uh, this is not only important for the prevention of the stone, but for the overall health. Like, it prevents constipation, it keeps our GI tract healthy. Now, the second question which the patient asks is, what type of fluids? So I just advise them, you can drink any fluid except alcohol. Because there is a myth in the common population that if you drink a lot of beer, your stone which is stuck in the ureter will come up. But that's not true. It is not the type of the fluid which you drink is important. What is important is the absolute volume of the fluid which you have taken. The more fluid you will take when the stone is stuck, the more fluid you will take, more urine production will be there and the stone will come out. And for the prevention of the stone, you should drink at least 3 to 3.5 liters of the water daily so that any small particle which is deposited is being flushed out through the urine. People ask that our water is hard. So in the studies, there is no association between the water hardness and the incidence of the stone episodes. Now, as I discussed, that one of the important factors of the crystal formation is the low urine citrate. Why few people develop the low citrate level in the urine is that because of the diarrhea, there is loss of the alkali, the acidosis is more. So whenever there is acidosis, so urine citrate volume goes down. And it can be seen in the lactic acidosis, distal renal tubular acidosis, and one of the important, the people who are taking more of the animal protein, their acid load is more, and their citrate volume is less. So that is also an important causative factor in formation of the stone in the non-vegetarians, especially who are taking more of the red meat. So we'll discuss later that there are many types of the stones, and one of the common stone is the uric acid stones. And so for them also the same advice: you drink a lot of water. When somebody consumes more animal protein, their uric acid production is more, and they get uric acid stones. So that's why we advise them, please decrease your red meat content. Yes, as I told you, the non-vegetarians, especially, they have to decrease their red meat quantity in order to decrease the incidence of the stone formation in future. Now, this is an endoscopic picture when we do the retrograde renal surgery, RIRS, to remove the stone endoscopically from the kidney. So this is the picture of a Rendell plaque. That is the initial formation of the stone which happens in the papilla. Why I'm showing this picture is that this is the initial formation, how it looks. And there is a vascular theory behind this. What happens is that the calcium particle is being deposited there that causes injury to the papillary vasculature. And there is atherosclerotic like response which is seen there, and that precipitates more and more crystal formation. So, like the preventive measures which we advise our patient for who have atherosclerosis, basically who have hypertension and metabolic syndrome, the same precaution are for the renal stone patients. As I told you, the role of the atherosclerosis in the stone formation. So there is a role of hypertension. In the hypertensive individual, those who have high blood pressure, they have more urine calcium excretion and compared to the normotensive patient. So it's always advisable for the patient, please control your blood pressure. This is also healthy for your kidney. If your blood pressure is not controlled, that's not good for the kidney in the long run. This is an important slide. The second important thing after taking more fluid is to decrease the salt intake in order to prevent the formation of stone, because the more of the salt we take, the sodium excretion in the kidneys is more, and the sodium precipitate the calcium particle deposition. So that is a common mechanism which happens. So that's why it is very important to decrease the salt intake. The salt intake per day should be less than 5 grams. It is advisable, please don't sprinkle salt on the curd or on the salad. Avoid pickles and avoid salty things. Now, less salt means less hypertension, less blood pressure, less stone formation. Now, as I've told you, that metabolic syndrome, which includes diabetes, blood pressure, obesity, and dyslipidemia, these all comprise metabolic syndrome, and this is one of the important causative factors why the stone forms. And these patients have twice the chances of stone formation in compared to those who don't have the metabolic syndrome. And diabetes. Diabetes increases the risk formation of all type of the stones, especially the uric acid stones in particular, because there is urine stasis. The urine is acidic. There is hyperuricemia in diabetes, and there is hyperglycemia. Hyperglycemia causes more calcium and oxalate stone. So we see that in diabetes, in all type of the stone formation is more. So it is advisable for all the people who have diabetes, please focus more on the sugar control. Now, as a urologist, we see more diabetes people because they are coming to us with increased frequency. So we always advise them for the control of the good control of the sugar. Now, the common people in India, what they understand is that they have to take the medication and they have to avoid the sweet things. But we have to reinforce them that the drug is only one third of your sugar control. The next one third is the daily exercise. We have to reinforce that at least 30, 40 minutes, 60 minutes, whatever they can do, they should do daily exercise. And the third thing is, uh, apart from the direct sugar, you have to decrease your indirect sugar also, like the biscuit, the namkeen, the bread, rice, and there are so many potato, there are so many foods which have high glycemic index. So it is advisable for them, please decrease those also so that your sugar control is more. If the sugar control is good, uh, in the long run it's good for your kidney, and the stone formation is also less. Then uh, obesity, like in the metabolic syndrome, more BMI, more chances of the stone formation because there is urine excretion of all the salts. So when there is more supersaturation, more salt formation. So uh, it is also very important in India because not only in the West, in India, the obesity is also growing very rapidly because of the easily available processed food, because of the carbohydrates. So the processed food should be less. For to prevent the obesity, we need to inculcate the daily exercise in our daily routine, and we need to have a good diabetes control and a good diet. Whatever we'll pour in, that is going to come out. So same is for the weight loss. So the people who are looking for the weight loss, it's important that it is the amount of the carbohydrate which is going in that is mainly responsible for your weight. And believe me, for the weight loss, 90% is your diet and 10% is your exercise. And the diet which you need to decrease, as I told before, these are the things which you need to avoid, and you need to slightly increase the protein intake. Now there are many type of the stone. The most common type of the stone is the calcium oxalate stone. So that's why the patient who develops stone, and whenever the stone passes out by themselves or it is removed by some surgical procedure, we always get the stone analysis done to find out what type of stone it is. Now, calcium oxalate is the most common form of the stone. So if we understand, we take calcium in our diet, oxalate in our diet, both are absorbed in the blood. They go to the kidney, calcium oxalate, they combine, and calcium oxalate stone formation is there. So there are few special conditions, like after the bariatric surgery, after the morbid obesity surgery, and those who have chronic diarrhea because of the uh, IBD. So there the fat malabsorption is there, and there the calcium oxalate is more available for the excretion in the kidney, and they have more calcium oxalate stone formation. So it is also very important because the most common type of the stone is the calcium oxalate. So you need to decrease the oxalate rich foods. Now remember, you have to decrease the oxalate rich foods. You don't have to stop them, because this is also, the commonly the patient will come in the OPD, and that they will ask, sir, should I stop eating the spinach, tomato, pomegranate? Uh, no, you have to decrease the amount of the oxalate-rich foods, which are okra, spinach, sweet potato, almonds, peanut, pistachio, and chocolates. And so these are few list of the oxalate-rich foods. Their amount should be less. You don't need to stop them. Now, another important factor in prevention of the stone is the moderate amount of the calcium intake. Now, it is a notion that should you stop taking calcium? No, you should not, because calcium is very important for our bones, and we always advise moderate amount of the calcium intake is because you'll take calcium, you'll take oxalate. Calcium oxalate will bind and will pass through the intestine. Less of the oxalate will be there in the kidney. So we always advise our patient that in case if you are allergic to milk or lactose intolerance, then obviously you cannot take milk. But if these two are not there, you should drink at least 2 glasses of the milk daily. You will get a good calcium intake and less stone formation. Infection stone is also one of the common stones, especially they are seen in the diabetes and the spinal cord injury patients. Now, disturbance in the urine pH is also an important causative factors. Like acidic pH, you'll get more of the uric acid and the oxalate stone. Alkaline pH of the urine, the infection stones will be more. Now, as a urologist and as a physician, it's our duty that whenever a patient of stone comes to us, we should always check his calcium level. Because if the calcium level is more than 10, we should check his parathyroid level. Because hyperparathyroidism, it has been seen that at least in 2 to 5% of the stone patient, this is also one of the causative factor. And these patients, they form stone very rapidly, and they might need parathyroid surgery, and that will decrease their future chances of the stone formation. So it's very important, always check their calcium levels. And those who are forming repeated stones, a metabolic workup is mandatory. We need to do the metabolic workup, which means there are some blood tests and there is collection of the 24-hour urine. We collect a full day urine sample to evaluate their salts, like what might be the causative factor in you, why you're forming the stones. Although in 80 to 90% of the patient, we don't find any causative factor, but there will be 10 to 20% where we might find a factor for prevention of the stone. These are few of the indication where we always do the metabolic stone formation. Those who have stone in both the kidney, the children with stone, those who have recurrent stone formation, and those who have single kidney, those who are morbidly obese, and there are other indication as well where we always check what factor might be there, why they are forming the stones. So as I told you, we get done the blood test and we collect 24-hour urine to check what type of salt excretion is more in the kidneys. Like one of them, the most common is the hypercalciuria, means calcium excretion in the urine is more. And that level is checked, and accordingly the treatment is given. Maybe alkaline citrate, or if the level is very high, then they may need a diuretic so that the excretion is more and their deposition will be less. Now, there are many patients, they ask that we are taking the calcium and vitamin D supplementation. So do we have more risk of the stone formation? So if your physician has advised you for the calcium and vitamin D supplement, it is very important for all the patients. Please do check them at regular interval, and don't just take calcium and vitamin D supplements by your own. Take your physician advice. So they will check your levels and accordingly they will give you the prescribed dose. Now, next thing is hyperoxaluria. The oxalate excretion is more, so we check their level. If that is high, so they may need the treatment in the form of the calcium or pyridoxine. I told you in the starting that citrate is a friend. It prevents the stone formation. So if we found in the metabolic workup that you have hypocytraturia, the citrate level is less, so there we give the patient the potassium citrate. Now there are many urologists who prescribe potassium citrate for the future prevention of the stone for long term, some 6 months, some up to a year, and some even longer. And then there is important that we check the potassium level. Now, for the uric acid stone, the uric acid excretion will be more. So we advise them drink plenty of fluids, decrease your animal protein intake. And if their level is high, if their blood uric acid level is high, then they will need the medication, maybe febuxostate or allopurinol, so that their uric acid level is less. Now, one of the this is also one of the common scenario that the people, because now they are more aware, they are going for the health checkup. They do an ultrasound and they found that they have a small stone in the kidney. So they ask, what should we do? So what exactly is a small stone? The stone which is less than 5 mm is a small stone. And do you need any treatment for this? No, and no, there's no guideline which recommend treatment for these stones. But yes, if the stone is stuck in the pipe, maybe it is 3 mm, 4 mm, you will need the treatment. Or there are two special conditions, especially in the pilots and those who are in the merchant navy who will be going in the sea. So there, because of the professional in which they are, they need removal of even the smaller stones. Otherwise, in general population, a small stone in the kidney which don't have any obstruction, that don't need any treatment. So patient will ask, what is going to happen? The stone is going to stay in the kidney. There are 50% chance the stone will pass by itself through the kidney. And there are chances that it may grow. So we have to follow it up with the ultrasound 6 monthly or 12 monthly. And then later on, depending what is the fate, and then we decide the treatment accordingly. The stone may drop in the ureter, may pass itself, or may stuck. If it is stuck, it may need an endoscopic removal. So finally, the take-home messages which we should tell all our stone patient that the dietary advice, number one, take adequate fluids. The water intake 3 to 3.5 liter of per day. Second, less salt intake. Salt intake should be less than 5 gram. Thirdly, for the non-vegetarian, decrease your red meat intake. Fourthly, we advise the patient that please drink at least 2 glasses of the milk daily if you don't have any lactose intolerance, means moderate calcium intake. Decrease the oxalate rich products. Don't stop them, but you need to definitely decrease their quantity. You have to take the diet which is rich in vegetable and fiber. That is very important. Now, Indian diet is full of salt and sugar. We need to cut down on both. If we cut down on the sugar, the diabetes and obesity is less. If we cut down on salt, the chances of blood pressure and the stone particle formation is less. The lifestyle advice, now maintain your BMI. Don't let it go in the obesity range. Avoid obesity because this is the culprit of many diseases, not only the stone, and especially the obese patient who have got the stone. It is technically challenging for the urologist for their removal, and they have some anesthesia related complications as well. And you need to have adequate physical activity in your daily regime, 30 minutes or 45 or 1 hour, whatever you can do in your daily routine, because the number of hours which you will spend in your exercise now is going to decrease the number of hours in the hospitalization in your later years. And then the stress management, that is also very important. Some kind of yoga, pranayama, meditation for at least 10-15 minutes you should inculcate in your daily goal. That will keep your overall health status very good. Now, this is most important thing which we always tell all the patients, that please don't ignore the stone. Now, stone is a disease which is treatable, which is curable. We take out the stone and the disease is gone. So if somebody has stone in the kidney and your doctor has advised you some follow-up ultrasounds, please get them. Don't ignore, because we have seen patients losing kidney just because of the stone, and that should not happen, because stone is a treatable thing. And if you follow these dietary and lifestyle changes, then the stone formation uh, is less in future. So thank you.
Yeah, thank you so much, Dr. Deepak Kumar. It was an insightful session, sir, and very informative. Thank you for sharing this with us. And I would like to thank you on behalf of all the doctors who joined today and from Library. And we look forward to host you again in future, sir. Thank you so much for your time.
Thank you and welcome. And I would be happy to be online again on Library. Thank you.
Yeah, yeah. Thank you. You're welcome.